The first presumed positive case of SARS-CoV-2, the virus implicated in the development of COVID-19 infection, in Dallas was reported March 10, 2020. The following day, the World Health Organization deemed the spread of the virus sufficient to be termed a pandemic. This resulted in a series of business and school closures, which culminated in a shelter-in-place order issued for Dallas County. Anecdotally, the emergency department visits dipped following these announcements, which was unusual given the increase in visits seen after the first Ebola case was announced in Dallas. In this study, we aim to determine whether the observed decrease in ED visits reflected a quantitative decrease in visits at the ED at Parkland Memorial Hospital, a large county hospital in Dallas. Additionally, we hypothesized there was likely a sharper decline in visits from residents located further away geographically from the ED than those residents in the vicinity of the hospital. We conducted a retrospective chart review of visits by Dallas County residents to the ED using data from the electronic medical record system. We mapped these patient visits over 3 phases. Phase 1 covered the 3-month period prior to the first announced case in Dallas. Phase 2 began with the announcement of the first case on March 10th and ran until the shelter-in-place order went into effect for Dallas County. And Phase 3 began the day the shelter-in-place order went into effect and lasted until April 21st, 2020. We compared this data to records over the same time period from the previous year, 2019, to control for seasonal variation in the absence of a pandemic. We included 52,845 ED visits in the study. We found that between Phase 1 and Phase 3, there was a significant decline, 46% fewer visits that day per day. Figure 1 illustrates this change with the white marker denoting the location of Parkland ED on a map of Dallas County by zip code. The blue represents areas in which visits per day declined between Phases 1 and 3, and the darker the blue, the greater the decline. It is clear that there is a general decrease in visits, and those zip codes furthest from Parkland had the largest declines. In addition, when compared to visits over the same time period from the year prior, we found there was an increase in visits over the first phase, an 11% decrease over Phase 2, and a 44% decrease over Phase 3. As such, it appears as the pandemic began to cause closures, the number of visits continued to decline even after accounting for seasonal variation. Figure 2 shows these changes mapped for Phase 3 between 2019 and 2020. The overall 44% decrease in visits was statistically significant, and many zip codes located further away saw reductions of over 50% compared to the previous year, which shows that changes in ED utilization were not uniformly applied across Dallas County. In conclusion, a significant decrease in ED visits per zip code were observed over the course of the pandemic and relative to a non-pandemic year. There are a variety of factors which may have contributed to this phenomenon, including fears of being exposed to the virus at the hospital and the shelter-in-place order making travel to the hospital less accessible. It seems unlikely that the need for healthcare services declined equally over the course of the pandemic, which suggests that many residents who would have benefited from medical care were deterred from or unable to access healthcare. These results have implications for future pandemic public health messaging and targeted outreach to communities with barriers to healthcare access. Thank you for listening to my presentation.